These are some rich ideas and concepts that have been presented here, and I'd like to invite you now to kind of engage with one another, picking up on some of the things you heard from one another, and maybe pushing for a little more, breadth or depth of explanation, or however you want to take the time. But it'll take about 15 minutes for you to interact with each other as healthcare providers and experts, to push the question a little bit farther.
Well, one of the questions I had, and for both of you all, is related to education. You both kind of brought up education and the importance of education. And do you find that educating your patients, education and motivation, I guess, both of those are kind of two parameters that I think are really challenging. And for us as healthcare practitioners, getting our patients to be motivated and educating them in such a way that they are motivated, I think is sort of a huge challenge. And I just wondered how you go about doing that, especially with younger people, in terms of getting them moving or eating better. Or
that is a big challenge. It's very difficult to give someone motivation if they don't have it. Mm-hmm. It seems like, especially a lot of the patients I have that are younger, they just want me to adjust them and get them out of pain, and they're fine. And it's a good thing that they come to see me before it gets worse, but a lot of the things they do to their body, they don't feel it until they're 60, 80. So they abuse themselves, and it's kind of hard to get them to see that they need to take better care of their bodies. Now, as my patients come in that are older, they have more motivation.
Health is a great motivator. Yeah.
They realize as they get older that their bodies have been abused and that they need to take better care of it as they start losing it. Mm-hmm. So how do we give them more motivation is kind of difficult.
Mm-hmm. Yeah, it's tough with my... when I would see a younger female, teens, 20s, for missed period, pregnancy scare or something, I had to quit asking what you're using for contraception, because so many of them didn't even know what the word meant. So I had to start using birth control, and most of them understand that. And how you crack that in a 15-minute office visit, beyond me. You just kind of start chipping away. But those educational deficits have been a long time coming, and I'm not sure where you even start to chip away at that. Time's very limited at the office. The handouts that we give patients most of the time find their way on the floorboards of the car, I'd imagine. It's just, the one thing that you can do in a family practice office is seeing people and families kind of longitudinally over time, is you can start reinforcing things and start using some of your other folks in the healthcare arena, your dietitians and your therapists. But in the ER setting, it's very different, and there's limited, if any, time for education. You're just putting out fires.
That's one of the things I think is so important for people to understand, is that physicians have just such a limited amount of time that you can't really expect a physician to be all things social service oriented and as well as healthcare oriented. And it seems to me that and chiropractors as well, that drives home the important point of getting more community involvement in the healthcare education, whether it be educating at the school level, in elementary school or middle school, or in the faith communities, having events related more to health education. These seem to me to be critical if we're going to really have an impact.
Yeah, the events are very important. Anytime I can get out there and talk to people, hopefully I get some information to someone that they can use it. So anytime we get a chance to speak in the community is a good chance to help somebody.
One thing I have found in interviewing people who have had stroke who live in rural communities is that they don't know other people with stroke. And it's partly because they're so isolated. And I think to myself, it would really be good to be able to have an alliance, like an alliance around the area of stroke or brain injury, so people could meet each other and find out and educate each other, and caregivers who I think really need special attention too can share with each other what has worked, what has not worked, kind of the real...
In my hometown in East Tennessee, there was a partially private, partially state-funded adult center, for elderly who didn't have many other resources to rely on, that they could go and hang out and play cards and have lunch and just kind of socialize for the day. Is there anything comparable to that here? Yeah.
Yes, we have the Washington County Senior Center, which is downtown. You can go and get lunch for, I think it's only $1, maybe $2, and then there's bingo or cards, or they have.
Is it actually
sometimes
used? Because we lived about 3 doors down from the Nelson County Senior Center, which had maybe 6 people there any given day. Is this one actually utilized?
On a given day there'd be 20 to 30 people eating there.
It's interesting. I think one thing that occurs is that, and I think there's actually a senior center in most communities, because I think I think they're federally funded. I couldn't name the agency, but I think there are a lot of resources that are well kept secrets because, and I don't mean that they're kept on purpose. I just mean that I don't think we really have a good way of disseminating information. I even think they have vans where they will pick up people.
Well, now there's TAC, Transit Authority Central Kentucky, but I'm not exactly sure of their criteria. And when I have to, and it doesn't happen often, but occasionally I'll have to tell a senior, I don't think you should be driving. And we have no public transportation. And if they have family members that can take them somewhere, I mean, you're essentially pulling the plug on their whole life.
Right. That's right. Taking away the keys is very,
very people, they're not happy when you do that.
No.
Very difficult. Protect other people, and that would enhance the connectedness you're talking about. But our senior center is pretty well used, but it's a great medium to launch more awareness and the things you're talking about. It's already there established.
Yeah.
Does tax service this area as well?
Yes, I see the trucks around in the community, but we don't have a taxi company. If there were a taxi company, then someone, if it wasn't too expensive, someone could call a cab and get to an appointment or get where they need to go. But
do we have, like in Washington County, like a volunteer center where there's an organized approach to volunteerism? Because that would be a really nice addition to the community, wouldn't it? So that if you wanted to volunteer as a driver for one day a week, that could be, a service you could provide, and then somebody who needs a ride could call that service. I think, does the senior center have a van?
I'm not sure they have a van, but I think they do have a used car company.
Because I feel like I have seen that van down on Chaplain Road in our neighborhood, and I thought it said senior daycare.
There's a car sale that sends a van over here.
Oh, is that right?
Right?
Oh, maybe that's what it is.
Day.
That's what it is. Active Day, yeah.
I spent 2 months I trained in Northeast Ohio, and I spent 2 months at a largely Amish community in Geauga County, Ohio, and seeing how they took care of their elders was a remarkable study in success compared to how us English do things. Because frequently the whole extended families within a stone's throw of each other.
Right.
No loved ones rotting away at a nursing home that are never visited. I mean, they take care of theirs as they age. Pretty successful story that they have.
Well, that was what was so impressive about my client, the guy I interviewed named Chuck, is that he had a devoted family, but they were exhausted and they needed respite and support. And they didn't want him to live. They wanted him to live at home. He wanted to live at home. He was sort of the patriarch of the family. I didn't see him going anywhere, but I kind of figured his wife and daughter would die before he would go anywhere, you know. And I felt like that if they had community support, they all three could have such a much better quality of life. And so, you know, we don't have perhaps 5 or 6 farms of families connected to each other like the Amish do, but we do have each other. So maybe opening up in that way makes the difference, would make a difference.
I wanted to ask you all, going back to the question of people wanting you to either give them a manipulation or give them a pill, you know, fix me up so I can go on and continue as I have always been. Do you see a connection between that approach to our own bodies and the last 150 years or so where we've seen the whole of creation as a machine? I mean, you know, since the Industrial Revolution, we started thinking of all of this as a big machine, and you can put chemicals on fields and have certain results, and you can tinker with the way, you know, or a stream runs and have certain results. So would the same be true of give me a pill, give me a fix, and that takes care of it because my body is a machine too? Do you think there's a link there?
There probably is. It's very interesting that today's society, or the more modern man, is starting to get away from that idea. It's taken a long time to get there, and it'll probably take many more years before we completely get away from it. But it has been a very common thing that most Americans, they want a pill. They want something instantaneous to help them feel better, to help them overcome whatever difficulty they're having. So I believe that has come from the Industrial Revolution, because there were many doctors that thought, well, a part of the body is worn out, just take it out and replace it. Of course, we know that that doesn't always work. Chiropractic care, sometimes people get better or they feel less pain with just one adjustment, but that doesn't always fix the problem. There's something more underlying that should be addressed, and I do the best I can to teach them that. I don't know, in the medical field, you have very little time with a patient, and most of the time they come looking for a drug.
Frequently.
Because they want something quick and easy. I remember reading a book years ago where the author was telling how most people wait until they're in severe or dire straits before they go see the doctor. And by the time they get to the doctor, they're so far gone that the doctor has very little room to fix it or to get them better before they actually expire or to get better. So if people thought more of what we can do to be better and healthier earlier in life, well before they start feeling the symptoms get bad, then my job would be easier, and I think everyone would be healthier, happier.
I really like the idea about promoting wellness. I think that's a really key thing. Raise the consciousness of it.
Yeah.
That will help motivate people maybe too. I mean, what motivates people to take drugs all the time? Pleasure, get rid of pain. Why does everybody want to get some kind of drug? Street drug or pharmaceutical? They're motivated to do that by some means.
Yeah, to feel good.
Pain. So you should be able to motivate people to want to feel good without that and be well.
Right.
And maybe not abuse themselves like that.
I was just thinking about what you were saying, Sister Claire, about the Industrial Revolution and motivation. You know, motivation really is a product of if you value something and if you feel confident that you can do it. So it's really kind of twofold. It's not just that I value being healthy, it's that I'm confident that I know how to do it, or that I value feeling better, and that I'm confident that I know how to do it. So I value feeling better, and I'm confident I can get that street drug to do that. I'm just trying to think of how we can turn that around through some kind of a public campaign and the leaders in the community really saying, you know, you want to feel better, you know, walk a mile. I know that sounds kind of simplistic, but yeah. Well, yeah, I mean, you know, at least we stopped naming our festival the Tobacco Festival. I mean, not that I'm anti-tobacco so much as I am, how do we promote health and reduce smoking when we promote tobacco through a festival? You know, it's this difficult thing to figure out.
There was a representative or a senator here just talking about the street drug issue at one of the schools, wasn't there? I only glanced at the paper.
Yes, Attorney General Conroy was here talking to the middle school about the dangers of prescription drugs.
Yeah.
I know a lot of older people are afraid that physical activity is going to hurt them. So there's a fear, especially if they have arthritis or they have cardiac disease. And so I like to say to them, well, the Surgeon General, because the voice of authority matters a lot, the Surgeon General says that inactivity is hazardous to your health. So I think using
I generally tell my
voices of authority,
you know, osteoarthritic folks, you know, the more you do within reason, the better
you're going to feel.
Yeah.
Yeah, but they don't know that. That's a lack of knowledge, I think, and a fear.